The number of COVID-19 infection cases continue to rise daily, with the government through the Ministry of Health remaining with a bigger task to have hospitals' capacity to handle the pandemic increased. The caseload already at a steady rise. With the daily surge of COVID-19 patients, the Ministry of Health has embarked on a tour to different hospitals in a bid to boost their capacities. On Wednesday, Health Cabinet Secretary Kagwe made his maiden tour at the Kenyatta University Teaching Referral and Research Hospital to evaluate the efforts made in handling COVID-19 patients. With Cabinet Secretary Kagwe arguing that health facilities have not been overstretched, the Kenyatta University Referral Hospital carries the bigger burden of the 60%. Nairobi's caseload as of Wednesday, 650 beds were already under use, with now the addition of 500 new beds, raising the capacity to 1,150 beds.
Those 650 beds, 150 were using for the cancer and other issues, and then some 500 beds in different systems were put together when COVID came in March of this year. You will remember that after Bagathi, this was the second institution that we came to look for quarantine and isolation facilities. And at that time, if you remember, we had 8 infectious disease beds, out of which we have grown to thousands of them. When you think about the fact that they have got this, they already had 24 beds. They are putting another 60 beds. That brings a total of 84 beds, 84 HDU and IDU beds in one institution, in only one institution. And that's not a small measure. And when you consider that they have got over 1,000, if you put all those things together, they have got over 1,000 beds. And I saw Kenyans circulating a video around. I think I said it the other day. I saw you people very excited circulating a video around about how Ghana has got a 100-bed capacity. And you are so excited and saying how great Ghana is.
With the high rising number of COVID-19 cases, especially in Nairobi County, the health facilities staring at a possible overrun by the infections, the Kenyatta University Teaching Referral and Research Hospital has stretched its ICU and HDU bed capacity to 60 with an already existing 24 beds.
We have planned for 60 ICU/HDU beds. Today we have 30 that are ready, and the remaining 30 will be ready in 2 weeks. But also would like to add that out of the 24 beds that we have already for ICU, we have 15 with patients, so we still have a capacity of about 9 or 10 left. So as we do that, we will still keep adding the rest.
And today, we have to start that process. We have already installed some 30 beds, and we are glad to say that as opposed to popular opinion, that the health sector in this country has been overwhelmed, even the original 24 that we had put in place are still not fully occupied. So it is not true to say that we had been overwhelmed. Nonetheless, it is better to be ready in advance than to be rushing if the facility were to be so overwhelmed.
The move to continue scaling up hospitals' capacity comes at a time where 20 Cuban doctors are waiting to be dispatched into the counties to aid in battling COVID-19. The Cuban doctors have been on a 14-day isolation at Kenyatta University Referral Hospital before now proceeding to the counties. With COVID-19 cases on the rise, the increase in capacity at the Kenyatta University Referral Hospitals seeks to be a major boost for the government in containing COVID-19 infections in the country. Chris Sambo, KUTV.